It is very frustrating, especially when the patient's getting in and out of bed and onto stretchers, office stretchers. They're getting up to go to the bathroom, and you're unplugging these poles and trying to maneuver around with them. And it's very hard for us and the patient as well.
The frontline staff doing the job are the best because you go to them, they tell you what their challenges are and what would really make this much simpler.
Well, a lot of the bags are heavy when you're putting them up above your head after you've worked an 8 or a 12-hour shift.
And it was an obvious how we could modify what we had in existence and certainly improve it.
Well, they're amazing because there's no more lifting above your head. Everything's done pretty much below the shoulders. I'm not on my tippy toes anymore. It's the weight. You can tell the difference with the weight. That's the biggest thing.
And I think the staff were very thrilled that you know, we were listening to them and taking their suggestions and trying to move it forward into something that would certainly improve a small part, which could be a major part of their work environment.
We were so successful in the last year that we received a rebate on our WSIB premium of $123,000. The decision was made to reinvest back into prevention. Our initial purchase will be for approximately 190 of the new Lakeridge Health Elevate IV poles. And that represents almost 1/3 of the entire fleet of IV poles that we currently have here at Lakeridge.
It will be a huge difference. It's going to probably cut down on a lot of workplace injuries.
Oh, it's so much fun right now. So if I can bring a pole up and I can be the one to deliver it to them and explain it to them, and it's always warmly received. Awesome, and then if you know if this is yours, give it a try. You know, work with it. It's very rewarding.
To be able to provide a safer work environment for staff, for me, is the ultimate.
It just brings a positive light to know that they are aware of the strains that the nurses go through and how much we're lifting per day, and that they're doing something about it to actually help us and help our job.